So as Debbie said, I am Dr Farah Josephs, but I'm not a medical doctor. Really important in today's session. I am, however, my background is in computer science and artificial intelligence, so hence the digital aspect. I'm here to talk to you really mainly about access to medical services online. And so really the session is really meant to explore what's available on the NHS website and through the NHS app. Feel free to ask questions at any point. If you need to interrupt, that's absolutely fine. It's important that all the points that I make are clear. So yeah, do feel free to ask questions at any point. And we have Marta here, who's a real doctor, and she'll be able to answer some of the more difficult questions. Okay, so we are going to talk about the NHS website because there is so much information available, and a lot of people aren't aware of some of the functionality that's available on the NHS website. So we'll explore that. We'll have a look on phones and see and have you also access that information so that you feel comfortable using it. And then we're going to talk about accessing medical services in the different ways that are available to us and how that's evolving over time as well. We're talking about choosing where to have your NHS treatment. Believe it or not, there is choice there, so we're going to explore that. We talk a little bit about immunisation as well, and then we go into the NHS app, how to install that, how to use it, and what is available to do through that. Okay, so the first thing we're going to look at, probably the first part of the session, is going to be around the NHS website. To access it, nhs.uk. So I don't know if you have your phones on you. We are going to do an exercise afterwards. So what we're going to concentrate on now is just talking through the functions available, and then we're going to go on our phones and do a couple of exercises. So the first thing that we can find on the NHS website is how to look up conditions and treatments. So that is catalogued by A to Z, and you can look up really any illness, and then you'll be able to find out more. So it's really a very useful resource for looking up symptoms or treatments, even before you go and speak to your doctor. It's just to have that background information. It is important that we use trusted websites. So I work very closely with public health and with the NHS, and we are guided through resources that we recommend people use, because there's so much information online, and it's really important that we use appropriate websites. So the NHS website.
I would second that. I would use that rather than Googling around.
Exactly. So really, rather than look up diabetes, just go into the NHS website, search under D, and you'll find that information. Or we're going to do that later on. So A to Z is it's the start, it's the first thing you see when you go into the NHS website, and we're going to look into that later. There's also a Live Well tab. These are the tabs that you see on the top. So the Live Well tab, and you can look up, for example, your BMI. So you can have your body mass index calculated by entering things like height, weight, and age and gender. So that's a useful one as well, and that's just a guideline because BMI is just to give you an indicator. Then that tab, NHS Services, is an extremely useful source of information, but also a way to do certain things. So that NHS Services has information about GPs, dentists, and that includes looking up GP surgery. So if you're planning to register through that, so it's not just for information. You can take action. You can register with a dentist, for example, see what's available, whether the dentist is actually accepting new patients, and even it's done by if they're accepting patients from the area or from outside the area. So it's a really useful resource. Prescriptions, you can order prescription. You can do a lot of what you can do on the NHS app through this. Whereas with the first few functions, you don't need to log in. It's available to everyone, and it's not personalized. That one, if you do start wanting to book anything, then it's going to ask you to log in. So if you are ordering prescriptions or registering or anything like that, you may be asked to log in. And it's the same login as the app. It's the same email address and password as the app. There's information about hospital, pharmacies and mental health, and we're going to look into that as well when we talk about choosing where to have your medical care. Is that clear so far? Okay, so vaccinations, a lot of information available on the website. I also have a flyer of all the adult vaccines that NHS put together. So that lists the vaccines available, the ages, eligibility ages and other information. So if you are interested.
Thank you very much. You are my saviour.
If you are interested, then come and speak to me afterwards. I'm happy to share the flyer as well.
Right, should we just hang on and let these two sit down?
Hi,
Bruno. Bruno, you won't see anything from there. Come and join us over here.
Hi, Bruno.
I've been here half an hour. Luckily the lady saved me.
Yes, There's a seat here, or one there, or one next to Gillian, okay?
It's taken.
That's very cool. Oh, there's one here, or one there, or one closer. Thank you.
Okay. All right. So let's continue. Okay. Hi, Bruno. So there is also information about travel vaccination, and we get asked a lot about this. So if you're planning a trip, what information is available on the website about what vaccines are necessary for travel, and if they are available on the NHS, you can have them done via surgery. If they're not, you'd have to pay for them privately. So some are, some aren't, and that will give you that information. So do have a look if you are planning to travel. You can also book vaccine appointments through the NHS websites. Okay, so obviously if you are invited to book a vaccine, you can follow the link and book, or you could just go into the NHS website and actually book a vaccine appointment. And now you can have vaccines in a variety of places. It's very convenient, so you can go to your local pharmacy even as they're doing vaccination. So you know that it's become a lot more convenient. And right now the flu and COVID vaccination are being offered. So there are obviously criteria for eligibility. You can check that on the website, but obviously you will get an invite if you are eligible. So do make sure that you are aware of that. These are the vaccines available to adults. So we have the flu vaccine, we have shingles vaccine, we have various other. RSV vaccine is a new vaccine, just one sec, that was introduced about a year ago, just over a year ago, and it's RSV is just another
It's respiratory virus.
Exactly, a bit like the
Which
flu.
used to be something that they thought only affected babies, young children.
Right.
It does seem to affect older people, but you have to be 75 to get it.
You do. So like, absolutely right. The flu vaccine is offered from 65. That one, and the COVID is from 75, and I think you're right. This one, yeah, 75 to 79. That's right. Sorry, you had a question.
Yes, the COVID vaccine.
Yeah.
Is it possible to request a specific one? Because I had 2 Moderna vaccines and reacted very badly.
Yeah. So
The last one was Pfizer and I was fine. Can I request Pfizer?
Yeah, so I think that what you have to do is when you've booked your appointment, you can call the chemist, for example, or GP, and just let them know beforehand so they make sure they have the vaccine. Now, AstraZeneca is stopped now, it's not available anymore, it's banned, but the choice I think is that in the main seems to be Moderna, but there are Pfizer vaccines as well, but you need to tell them beforehand to make sure they have a supply. Okay, so another thing that I mentioned, and again we're going to do an exercise on that, I just wanted to introduce the topic, is about hospitals. So that's another option on the NHS website, nhs.uk. And what you can do there is you can find out a lot of information about hospitals. But one thing you can do is called Patient's Choice, which is to have a look at waiting times for hospitals. Okay, so what you can do is actually have a look for a specialty, so it could be cardiology, for example, and have a look at, say you've been offered an appointment in 2 years' time, you can look and see what the waiting times are for any other hospitals that are close to you, and then if you find one that gives you an appointment sooner than the one you've been given, what you can do is go to your GP and ask if you can be moved to another hospital. Obviously your request may be declined, but you can actually request that. I have done it and I succeeded in transferring to another hospital. So, but it rather depends on capacity. But it's something that is available, and I think the NHS is trying to allow more choice, and I think you might find in the app in future they are going to allow some options in when you book your appointment in terms of timing and hospitals. Okay, and we're going to look at that. That's quite an important one. So those waiting times are updated weekly, so they're up to date, and they will tell you how many weeks, how many months, and so it's a very useful thing to understand and know about. Any questions on this one? Okay, there's also a function to look at GPs, to find the GPs. So yesterday someone was saying he would like to change his surgery, move to another surgery, he's moving house. So, and he asked how to find out, and that is really a very good way. Register with a GP surgery. That link will give you information, it'll ask you for your postcode, and it'll give you the options available, what GPs are nearby, how you can register. You can even then go and do the registration process. So it's very
also want to look at the reviews. They can be quite
Yeah.
helpful.
Very true.
As I know that people have very variable experiences in general practice, and I think the reviews can be helpful.
So actually on that as well, Martha, you can also look up consultants and doctors. So I remember someone saying, they've been given a choice of consultants. You can actually go and have a look, find out about the background of the consultant, so you can make an informed decision.
Pardon?
Which one is that? Let me check on the left.
So the reviews you can see, all practices will have reviews posted.
And we can look at that maybe afterwards as well when we
It
get on.
sounds a bit tricky because you might not
Yeah.
get that consultant.
Yeah. No, so it is true, but I mean, even in private sort of medicine, my friend was given 4 choices, and she said, eeny, miny, miny, whatever, how do I choose? And I said, look, you can actually have a look and,
Absolutely.
yeah, maybe not on the NHS. Okay, so we're going to do a couple of exercises so that we can actually look into this and find out. The first exercise is use the NHS website. So it's the first thing you see when you go to the homepage of the NHS. That's nhs.uk. Have a look at symptoms and treatments for asthma. So if we can get our phones out, and if we can go on the browser and go into nhs.uk, which is so that's the link. nhs.uk is all you need to type. nhs.uk.
If you need to get onto the Wi-Fi here, it's Club 2 and the password is Tuesdays with a capital T, but the reception isn't very good here, I'm afraid.
Okay, so I'm also going to show that actually I can also go into it myself and show you, so that may be another way to do this. Okay, so this is the NHS website. Are you, have you got that on the phone?
We're not going to the NHS App.
No, we're just doing the website. And this is what you'll see when you go into the NHS website. That's the first thing you see. And the first tab that we're going to look at is the Health A to Z.
Wi-Fi.
Okay, so I'm actually going to go into that tab, Health A to Z. nhs.uk, which is at the top. You can see it there.
Yes, start with Google and type in nhs.co.uk.
No, just no code. nhs.uk, no code.
Lovely, thank you.
Okay, so we're going to look at the health A to Z, and we need to find asthma. If you scroll down, we can look at conditions. Yeah. It is a little slow, but it seems to be connecting. Can you have a look at asthma? Just to see what is available on the website. Yeah. So that's asthma there. It is all in alphabetical order. Does anyone need any help? Yeah, all okay. Okay, so what that does give you, as you can see, is symptoms. It gives you when to see your GP, how to treat the asthma, when to call 999. If you keep scrolling down, it gives you a lot more information about how it is diagnosed and about treatments, inhalers and so on. So this information, the same sort of information is available for different conditions. Okay, so really it's the first port of call, I would say. If you want to look something up in terms of symptoms or treatments, that's the first place I would go to have a look.
Has everybody been able to find it?
Okay, so if we, while we are on the stay on the NHS website, and then we're going to look at something a little bit different. So if you look at the tabs there, after Health A to Z, you'll see NHS Services. If we click on that one, so this tab here, NHS Services, if we click on that one, please. Now, what that is going to give you is all the information that I mentioned before. So the GPs, the dentists, prescriptions and hospitals. That's a really useful functionality. Yeah, sure. Okay, so we are now going to look at the NHS services functionality. Is everyone okay to get to that tab? Okay, so once you click on that, what we're going to do, I'm just going to show you the functionality about looking up waiting times. All right, so I'm just going to go back a bit and just show what I've done. So from the main page, we're going to look at the NHS Services tab, which is this one. Okay, so if we click on that tab, just this one here, NHS Services, the second tab up at the top. Okay, so if you follow with me and just click on that tab, then you get to this page. So if we click on the hospitals option, okay, we are here. You will see the third option here is guide to waiting times in England, and that's for the whole of England, so you have to choose the region, okay? So that third option is where we're going to click now to look at waiting times. Okay, I'm going to click on that option now just to see the next page, which is going to take me to the waiting. So here I have the option to check hospital waiting times, and I'm going to click on that option. Okay? Yeah. So from hospitals, so basically you can see actually if I'm NHS services, and then I'm going into hospitals. That's it. I just go down. The third thing I see is guide to NHS waiting times.
Yeah, hers keeps keeps going back to the
Oh,
aspect.
Okay, I think if you're having issues, just watch what I'm doing, and that would be fine, because then you can do it at home. But it's really a question of navigating, going down the screen. But if you're having problems with your Wi-Fi or phone, just watch what I'm doing. I'm just
It's quite slow, the Wi-Fi, actually.
Yeah,
It's
it
not
is.
very
I know.
fast.
I can see. Yes. So if I go into waiting times, actually just watch what I'm doing is fine. So here it invites me to choose a region. So we live in London, so I'm going to choose London. Okay, and then when I go into London, I'm going to get a choice of hospitals, and I can actually pick one to find out the waiting times for a particular specialty. So I'm going to choose Royal Free London Hospital. Okay, so I have picked the Royal Free. You can pick any hospital that is close to you. And then I'm going to choose a condition, a specialty that I am, interested in for my appointment. So, for example, I'm going to choose cardiology. If I choose cardiology, I actually get 2 lines here for waiting times. And the first one is average waiting time for first outpatient appointment in the hospital is 15 weeks. And then average for treatment for the specialty is 17, so between 15 and 17. So for outpatient and for treatment, these are the 2 lines I get. So I get an idea. I think, okay, it's 15 weeks and they're all free. What I've been given is much longer than that. Perhaps I can request they're all free. And so that is a really useful, and I say it is updated each week based on data provided by the hospital.
Can you do this without going through your GP then?
No, so what you do the research beforehand, you find something, and then you do have to request it through your GP. Yeah, I'm afraid it has to, the GP can't make a decision, it'll have to be approved. The GP will then refer to the hospital, and then they'll make a decision. So that, because I've been through it as well, so I know how it works. And I requested it thinking, it'll never be accepted, but actually they wrote back to say, yes, that's fine. And then people do
So
change
I
hospitals.
think that is worth trying.
Yeah, people do change hospitals. Where there is possibility of capacity, then it is something that is possible to do. But what is useful is to actually get that data and know what the average waiting times are.
And
So-
it makes sense for the NHS to use what
Exactly.
So how long does it take a GP practice to action that? Would I do it with my online request?
It depends on your GP practice,
Yeah,
but
okay.
that's a very reasonable thing to do with it.
Yeah, actually yes, because you really don't need to go and visit the doctor face to face. It is something that you fill in, e-consult, I guess.
Exactly. Well, you consult on different practices have different things.
Yeah. Okay, lovely, good. Okay, so now we can see that how much there is, and this is just really a flavour of the type of things that are available to you on the website. Again, booking GP appointments, all of that again is available. So anytime you want to go back to where you started, you just click home, and then you take them back to the home page at the top. So you might have to wait a while, but that's how it works. Yeah, so it's taken me back to the home page. So yeah, just watch out for those tabs at the top.
Where do you click home?
So there was a home tab at the top on the left hand side, and then you click that.
If you scroll back to the top of your
Oh, you can just go back pages, but it is useful. Okay, so, and the arrow back will take you back as well. That's fine, but you have to do it one at a time. And then, so if then I go into NHS services, I'm taken back to that screen, and then I can look at, for example, GPs, and I can have a look at dentists. And that's a good one. A lot of people aren't aware that this information is available. I
So
only
you've got NHS dentists.
NHS dentists. Yeah, NHS dentists. So that's again very useful because a lot of dentists do only private, some do a mixture. But yeah, if you want to find out, and really it is very, very useful. So you can actually enter your postcode and find a dentist nearby and see if they are actually accepting new patients. A lot of them are full, so you might have to be on a waiting list, but you can choose. So that's really kind of the kind of things you can do with the NHS website. Are there any questions, or is there anything you would like to do on the NHS website that we can help with? Okay. So what I'm going to do is go back to my presentation.
Does it give information about medication and side effects?
Yeah, there is medicines as well. So again, that's something you can look up on the
People
NHS.
get quite concerned about that.
Yes. But there are also other websites for that, I think.
Yes.
Pharmacy kind of websites as well that provide that information. And a lot of people also want to check ingredients, and all that information is actually available. There is information about vaccination, as we said. Okay. So we've done those 2 exercises and we've seen what is possible to do. The other thing I wanted to highlight, and I have a flyer on this, is Pharmacy First, which a lot of you I'm sure are aware of. I've also brought with me some of the leaflets that Boots have mentioning what they can do. And what Pharmacy First is about is really a first port, well, I said the website is your first port of call, but this may be your second. So really, they can treat certain conditions. Pharmacists are now being trained by the NHS to treat certain conditions, and these are listed here. And they can, prescribe antibiotics now, which they couldn't before. So again, it's what, even if you are waiting for a doctor's appointment, you can actually pop into your pharmacy. Not all pharmacies are doing this, but a lot more. Something like 1,700 pharmacies are doing it. Certainly the bigger ones, Boots and Superdrug and so on. You may be able to walk in or request an appointment depending on the pharmacy. But this is really very, very useful for certain kind of more minor conditions that they can treat. If they can't, then they will refer you to your doctor. So they can't treat everything, but they might say this is not within their scope. And I've noticed as well, certain GP surgeries, when you call, there's a recorded message to say, have you tried Pharmacy First? Or the receptionist might say, well, actually, for this condition, can you please try your Pharmacy First? And if you still need to see a doctor, that's fine, come back and make an appointment. So it is something there that is there to relieve the pressures on GP surgery, but also to help everyone, to provide them with an easier and more convenient way to access medical care for certain conditions.
So I think that's a good thing, and it's confidential. There's usually a private room that you can be consulted in.
Yeah.
So the other thing that you may find is that for quite a lot of things, when you contact the GP will have an attached pharmacist
Yeah.
who will give advice about various medications, particularly about things like blood pressure, about which they're an expert, statins, that sort of thing. So both I and colleagues, friends of mine, have had actually a lot of our GP care with local pharmacists. Well, not the local pharmacists, the practice pharmacists. So that's different. That's not the pharmacist based in the chemist. It's a pharmacist that's based in the GP practice.
Mm-hmm.
And again, that's to relieve pressure, but actually they're specialists in that area, so it can work quite well.
Oh, it's really convenient because a patient sees a doctor and then they can go and get their medication from the pharmacy as well.
So the practice pharmacist will prescribe,
Right.
and then it'll go to the local
Oh, I
pharmacy.
see.
They're separate.
Oh.
I think that's an important distinction. They're attached to the practice.
Yeah.
And so they have, immediate access to the GP.
And that's very useful to know as well. Yeah.
Does the pharmacy discuss your medication with the doctor before she prescribes extra medicine?
So not if you go to the chemist for those sort of things. So those are things which should not interfere with your usual medication, but they should check what you're.
They will ask you.
When the doctor, because the pharmacy, we have a new system. The pharmacist phone and increased my statins. And I didn't know what to do because normally my doctor tells me what to do.
Well, that's exactly what I mean. So if that's the practice pharmacist, they will be doing it with access to your GP notes.
Oh, okay.
Yeah. So for things like statins, things like blood pressure, the practice pharmacist is likely to be in touch with you rather than the GP. And I think that's okay.
That's a very interesting point, actually.
Yeah, no, I've had a bit of experience of it recently, and I think it works.
So so a lot of medical practices have it?
I think increasing number, yeah.
Ah, okay, all right.
I don't know the number,
So I
but
wasn't
certainly the
aware.
one I worked at, the one I'm registered in.
Right. Okay, thank you. No, that's really useful to know as well. So there's now a lot more provision, a lot more choices. Any other questions on this one?
What's in vertigo? Is that
It's a
vertigo?
nasty skin rash,
Oh, skin rash.
Okay.
impetigo, and it's very infectious. Children have it.
Yeah, and you'll see, for example, earache for children, and I've been asked why is it just for children. I assume it's because there's different equipment required,
I'm not sure. I think it's because it's commoner in children.
more common,
And
or older people as well. But I think that's a different.
Yeah, I don't understand.
Yeah.
I don't know.
Yeah, that's fine. And this list may be expanded. Obviously, there's blood pressure checks as well that Boots do, and they have now blood pressure checking machines in GP surgeries. So you just have to put your arm in, and it will print out your blood pressure readings. So that is really very useful as well. Okay, so what's the time? It's 20 to 11. So we can do a little bit of intro on the app, and then break up. Would that be okay?
Yes, that's fine.
Okay, so we're going to talk a little bit about the NHS app, what it is, why it's a good idea, if we think it's a good idea. But I just wanted a show of hands first to see how many of you have got the NHS app on their phones. Okay, and how many do actually make use of it and find it useful?
I only used it during COVID.
So this is the thing. So I think what I'm finding from my sessions is people have it, either don't use it or use it in a limited way. So they use it for one thing, but they're not kind of aware of all the different things they can do with it, which is why we do these sessions, just to highlight what's available, just so to make sure people have maximum use of the app. And the app is secure, which is why it's such a rigmarole to register for it. It is because it is very secure. So it will ask for ID, it will get you to log in very securely, and that is really important, so no one can see your medical data. Okay? And then it is free from the app stores, you can download it, and we can, if anyone needs help today, I'll leave a bit of time at the end, either to actually install it or to look at how to use it effectively. So it is available to anyone aged 13 years and over who's registered with an NHS GP practice. That is the only condition. Yeah.
I've had it installed one time and I've registered and everything, and then the next time it won't let me in, I find out.
Did you have the correct password and email address?
I did, yes, and...
What was the
good.
message you were getting?
It just said it didn't recognise me.
Right, so we can look at that together.
Yes.
It could be that the email address is different to what you've registered with. Or did you actually complete your registration?
I did, yes.
Oh, you did.
And you were able to use it or?
No, it wouldn't let me in again.
Okay, it could be a login issue.
Yes.
Do you get past the login, or are you getting an error message before you actually...
Well, I took it out and now I put it back in again, so I've not tried it since I put
Right,
it back in
okay.
again.
Yeah, I mean, I think it could, so at the very first stage, it could even be an issue with the email address or the password, because that's the first thing
Yes.
that you have to enter. And
Right.
if say you've given it a different email address, maybe possibly some people have multiple email addresses, they log in with a different one, that is one possibility. But we can look at it as well and
Yes.
see what's,
Right.
yeah, I'll leave some time at the end and then we can do that. Okay. All right, so the benefits, twofold really. It's to help the medical professionals, because it is alleviating some of that pressure, taking away some of the more administrative work. Obviously that reduces the costs for the NHS as well. If you are able to do more on the app, then that means less face-to-face. It is more efficient, so it's quicker, with clicks. And then it is also reduced no-shows, and that's quite interesting. In GP surgeries, I've read somewhere that the NHS emailed us to say that there is evidence that it has reduced no-shows at hospitals and doctor surgeries, because people now have that information on their phone. You can actually now link it to your calendar and it will send you a reminder. But also it's there, you can just check, you're on the bus, you can just see, oh, tomorrow I've got, you do get reminders as well. And that is really important because obviously no-shows cost the NHS a great deal of money and they should be avoided at any cost. So it's helping the NHS, it's also helping us as patients in accessing the medical services quickly, conveniently. Okay? Just to give you one example, I went in to the hospital for treatment. I had a problem with my ears, they were blocked, I couldn't hear. So I went there. I went to, audiology, and I said, I've got an appointment at 11, and they said, no, you haven't. And I said, yes, I definitely have. Anyway, I was getting into a panic, thinking, I've taken the day off, I need to do this. I then realised I should go and check on the app, and I did, and it was a slightly different department, with a very similar name, but it was called something slightly different. And I showed it to them, and I said, yeah, look, I've got that, and they said, oh, actually, that's next door. I would have gone home, honestly, if I didn't have that with me. So also it reduces paper, so we don't have to obviously get letters in the post. This is available here. But if I'm not sure when my appointment is, I can look on the calendar, I can look on the app. Make sure you always remember the login for the app, because you may need to access it, as I say, on the bus or if you are waiting somewhere. So, it is very, very convenient and useful. That said, we have to emphasize that if you are someone who don't like using technology and don't want to use the app, that is fine. You can still make appointment, order prescriptions, do all the things you do. You just do them differently. But the important thing here is the more people that use the app, the more it's going to free up time for people who don't use it, who don't use online platforms.
Can I just check with you? I've got it online, but I only ended up getting it 'cause I think I was going somewhere and I need to find out COVID jab stuff. But it's on your medical history. My medical history is like I didn't exist until the beginning of last year, and I've been.
Okay, that's interesting. Okay, I can explain. I can explain. That's a good question. Mine has gone back to before I was born. Suddenly I looked and it's like, oh my God, this is when I was like so much younger. So that is, and if I'm correct, Marta, is uploaded by your doctor's surgery in the back office.
So there are two issues. One is I think you have to get the practice to do that. You have to get that permission. And the other is it's supposed to be much better than the old paper notes, but it's only as good as any paper records. So my paper records, until I was about 35, went missing years ago, and they don't exist anymore. No one can do that. So it's only whatever was in your paper records at the point that they put it on the computer.
You can.
That's quite surprising. I mean, I've had things like cancer in the past, and I've obviously got nothing at all. It's like just last year.
Ask the
GP to put it up.
Yeah.
Put it up.
Yeah.
So it's not that because it worries me that once these things are all digitalised, does that then mean they get rid of the paperwork, and then there's no record at all because it's not.
Well, once it's digitalised, they may get rid of the paperwork.
Yeah.
That is a real issue. But I don't think in your case that it's that they've done that. It's that it hasn't been uploaded.
Yeah. So in a lot of cases they're catching up. They've got backlog.
So they should.
But you have to check with the practice that they press the right button.
And if I am correct, Martha, I think there are different levels as well of access to sort of the data that you're given.
Exactly.
Yeah, so some people can see certain things, others can't. And again, that's something that you can discuss with your doctor's surgery. Mine has gone back a very, very long way.
I would expect I thought that it would.
Yeah, but that is down to your practice. So that's one thing my practice is doing very well. But
But also your records didn't get lost.
No. Yeah. I mean, they exist in paper forms, they also exist on the system. It's a question of uploading it moving it to the app. Yeah.
Can I ask a question?
Yes, of course.
This NHS app,
Yeah.
I've got it,
Okay.
but I've left my phone at home. So
Sure.
I've got
No problem. No problem. I've got mine, so it's
Yeah,
fine.
I've got the NHS app that
Yeah.
I have a password. I also had problems sometimes getting back into it.
Right.
It doesn't accept it. I also have something else
Yeah.
that I've written down and took a photograph of. and
Sure. Yeah.
That says NHS portal, and that's a completely different
It is.
thing.
It is.
And I don't know what the difference is. And
Yeah.
also, because I have quite frequent hospital appointments,
Mm-hmm.
should everything from whichever hospital I'm going to
Okay, I can explain.
be on the app?
Yeah, okay, I can explain that as well, because that's something that is coming up. I can explain it now. I think that there might be a slide. So there is a new thing now called Patients Know Best. You may have seen it. If you go into the app and you go into messages, I think it's tricky to find, but I found it simply by coincidence. I went in, and what that is, it's links in your hospital data as well.
Patients what?
Patients Know Best. It will ask you if you want to join that service. It is happening, but it's happening gradually, and not all hospitals are on board. They're coming on board, but it's a new thing that actually is going to be very, very useful. So for me, I have to log on to UCLH separately. I have a separate log on, completely different website, different password, and that's where my UCLH data is. That is going to be enabled through the app. It's not going to be merged, but it's going to be linked to it, if you see what I mean. So that is coming. Watch this space. I don't know when it's going to. It's
But
there.
This I've had for ages. This other portal.
Yes, the portal, again, there are patches, there are different ways of making appointments. They're trying to streamline all of this now, but I agree, it is different. Sometimes they share the same login, sometimes they don't, but there are different ways, and it is very annoying. The NHS app,
It's confusing.
it is,
worrying
it is,
because you
and
might miss an appointment or
yeah,
something.
I know. No, I
There's
know.
duplication. There is duplication. I think the portals were set up by the GP.
Yeah,
GPs,
so some GPs will use patches, some use this, that, and there are different mechanisms at the moment. But the aim of the NHS is to make the app their new platform for accessing your health services.
Patient Knows Best does show up on my app.
Sorry?
Patient Knows Best
Yes.
shows up on my app.
Yes.
But you have to register for that.
You
That's
do
a
have to
separate
register.
login to
Yeah.
the NHS app, which is again a bit of a message.
Yeah, you can use the same
You can use the
credentials.
same
Yeah,
password.
you can use the same password.
So
Yeah.
my advice, for what it's worth, would be to use the NHS app for things like prescriptions, communication with your doctor, appointments with your doctor. But when it comes to medical records, there's been, in the last 20 years, the NHS has been trying to get all these different systems to talk to each other and to see each other. And I don't think that's ever going to completely happen. So when you're talking about, so I'm under UCLH as well. I've got something called My UCLH,
Yeah.
and all my medical records are there. If I was under another hospital, I would also make sure that I had access to that.
Yeah.
I think it's slightly. I don't think we're ever going to have everything on the NHS app, if
Yeah.
I'm completely honest.
Yeah.
I mean, I have to be honest, my GP surgery was great for treatment.
Yeah.
But I had a problem with it, and also the pharmacist, I had a COVID jab.
Right.
And she said to me, none of your COVID jabs have been updated.
They should have been by the GP, yeah.
So, but I didn't have them at the
Mhm.
GP surgery.
No.
So it doesn't always work.
Yeah.
I don't know. And then I asked the GP, and they go, oh, I don't know.
Oh, I had mine at the pharmacy, but it's still on the app. The GP, the medical practice should do it. They will have a record of it, the
Yeah, but
GP.
they're no good at helping you if you've got a technical problem.
Right.
They just
No,
basically go,
that is true.
you
That
know,
is true.
no.
But you
Yes.
can, but actually the provision of the data, the uploading of the data, that is their responsibility. So they should be able to, if you raise that with them, and just say that's missing from your records. And I understand, because I've been helping people, and I'll say, open up your app, you'll see all your vaccination records, and it's not there, but it should be there. So you can, just remind them that you'd like that added to your app and upload it. They should have a record, even if you have it done at a pharmacy. That's not an issue.
So, I mean, what I've done is asked to sort of speak to somebody who knows what they're doing in an IT way, and ask them to actually do it while you're there.
Really? Okay.
I think it's worth it.
Okay.
If it's something that's concerning you.
Yeah,
Because there used to be an NHS COVID app and everything would go
Yes.
on that, but that's now been closed down.
that's right. Yeah, that closed down a few 2 years ago. Okay.
23, yeah.
So we have a bit of time just to go through what you can do on the app, okay? And afterwards we can actually try some of these things for people who have got the app on their phones, and maybe you can show each other as well. So booking medical appointments is one thing that can be done on the app as well as in other ways. And there are 4 ways to book GP appointments. Do we know what they are? Sorry?
Phone call.
Phone? One.
Very nice.
Sorry?
Very
Walk in.
difficult to
So on the phone, what you need is two things. One is a phone and two is a lot of patience. If you have those two, you'll get an appointment. Okay, what's the other thing?
Walk in.
Walk in. And some surgeries actually now saying we can't do it this way, but they might do it for you on the app themselves at the surgery if they have the time. But yes, walk in is not so much not happening.
Again, it depends on the surgery.
It depends on the
I mean,
surgery,
The
yeah.
variability is enormous,
Yeah.
I'm afraid.
Yeah. So
They're
it's
supposed to be able to help people who are vulnerable who can't.
Sure. Third one?
email.
Oh, 5. Who said email? Okay, so then there are 5. So email is another one, which I actually don't use, but if it is...
You refer,
Sorry?
is that one?
E-consult?
Refer, e-consult.
E-consult, so that the other thing is you can fill out an e-consult, and if you go on the GP website, most of them will have a link, book appointment, and then it'll take you to an e-consult form, which I think is very useful because it's giving them information about the condition that you want to seek help for, so they are prepared when they actually call you back. And I've used that many times, and it is incredible. I get a phone call within about a couple of hours. From the doctor, and sometimes if I don't need to see the doctor, my prescription is ready, I can pick it up after work. So for me it's worked well. In some cases it might lead to a face-to-face appointment, which is fine as well. But yes, that is a very good,
I tried e-consult and I couldn't get around that. I couldn't navigate it. Holly just gave me these questions I didn't want to ask.
To
That's
answer,
as far as
yeah.
I could get.
So they are asking about the
So I have mixed feelings about e-consult, and not all practices use it
No,
anymore.
but I tried it. They said they use it,
Yeah.
but I couldn't actually get around the site. It just gives me questions I didn't want to ask.
So I
And that's
think
as far as I could get.
I know that the questions that, so I think that if you find some way of not answering or getting down to what you want.
Yeah.
You couldn't find it. So the practice I registered with doesn't use e-consult anymore. They just use a system of do you have a medical problem or do you have an admin problem.
Really?
And
Oh.
I have to say that works quite well.
Okay, mine still uses it.
Yeah.
I mean, when you say you can't answer,
Yeah.
if you can't answer a question, you can always put something in, like, I can discuss it. I can discuss it on the phone or something.
Well, just questions. You have to take the right question, and that's as far as I can get.
Right.
So again, that is just
Okay, let's have a look at that.
what's the, like questions you don't want to answers you don't want to disclose? Is that all?
Well, they just give me a number of diseases which I didn't have, and that's
Yes.
as
So
far as I
you
could
just
Is there an others, was there another section?
get. No, there wasn't another section. That's as far as I could get.
Right.
Were they tick boxes that you just had to say yes
Yeah.
or no to?
yeah, they are.
I think if it was me, I might try and go through it by ticking a box that wasn't relevant and then moving on to the next thing and saying,
Yes,
I have
right.
this problem.
Yeah.
You sometimes have to game the system. I know
Yeah.
that's not right.
Right. Yes.
Mm.
If that
But
makes
you-
sense.
I do the same for my dentist now. Before I visit the dentist, they send me a form to fill out about do I have these conditions. And it is really useful to them, to be fair, because because they might sometimes prescribe medication or give you an injection, so it's useful. It's always useful background knowledge. It is confidential as well, as Marta said.
But if you can't get through the system, then
Yeah.
that's a problem.
If you can't, so that's what we're saying. So another way is through the app. There are different ways, or you can call and make an appointment or visit the surgery. So there are options available, I would say. Okay. So then the app, one function of the app is booking medical appointments. The second one is viewing your health record. We spoke a little bit about that. So that includes any letters you've had from doctors, any medication you've been prescribed, any vaccinations you've had. It's really useful as well because we do forget sometimes. More than that, I went to the dentist a few weeks ago, and he was chatting to me and asked me what I did for a living, and I explained. And what he said to me was, "Oh, I wish more people would use the app because he needs to sometimes prescribe something and give an injection. He needs to know what medication they're on." And he would ask them, and they'll say, oh, I don't know, it's a round white tablet this size. And then he'll say, well, I'm sorry, I can't prescribe anything, because in case do you know what it's called? They'll say, oh, I can't remember, I don't know, you know, what's the dosage? Oh, I have no idea. So, for example, if you're on blood thinning tablets, he can't do certain things. You know, it is very important that the dentist is aware. And he said, if they did have that information on the app, it would make my life so much easier, and it would enable me to treat them so much better and quicker. So, you know, it has so many benefits, wide-reaching, that we don't even consider. But when he said this to me, I thought, yeah, actually, that is really important. So your health record is there, and that's useful. Okay, ordering repeat prescriptions and nominating a pharmacy. You can do that different ways again. You can do it on the NHS website, or you can do it through your pharmacy. I do it through Boots. So I go on the Boots website and I do it. You know, there are different ways. Extremely useful, and in some cases, the medication is delivered to your home as well. And then it also gives you a reminder. So I get a reminder every month to say, oh, you're running out of medicine, you better order some more. They've added a new functionality within the app, which is to track your prescription order for two reasons. One, this makes it easier for us as patients ordering prescriptions to know where the order is at. So you could say, approved by the GP, waiting for approval, anything like that. But also it's relieving pressure on the pharmacies, who will get a lot of phone calls to say, you know, what's happened to my prescription? I've ordered it 3 days ago and it hasn't arrived yet. So, and a lot of the time what people are saying to me is, oh, my pharmacy don't even pick up the phone. And I'm saying, that's okay, because you can actually now track your prescription order. Again, we can sit on the phone and look at that, because it is really a very useful function to have. They're trying to get to the point where it actually pops up a notification through the app to say it's ready to collect. That's not available yet. It is available through the pharmacy. So my Boots keep me up to date, a bit like an Amazon order, to say, you know, it's now, you know, ready, come and collect it. It's not through the app yet, but the app will tell you if it's been approved or not. There sometimes is a problem, like the GP need to see you before they approve your prescription and so on. And just to give you one example, is I was speaking to a lady who was running very low. She had one tablet left for her blood pressure. She thought she'd ordered the prescription on her app, and she said, I'm waiting, I don't know what to do, I'm really low now. And so I said, well, bring up the app, and because they've got this tracking, we're able to see that actually hasn't even been ordered. So I told her to go and get an emergency supply, and then to order it after that, and speak to the pharmacy as well. So really it's quite a useful function, and as you can see, all of these things have a dual benefit for us as patients, but also for medical professionals as well.
Sorry, could I ask you?
Yeah.
So a lot of appointments or records are held by a hospital you go to. Could be the Royal Free Hospital.
Yeah.
Is it up to some data manager there to make sure that it's not just localized information, but it's gone into some central database?
Yeah, the GP will get a record of your GP surgery will get a record of your hospital letters, any appointments, any letters.
Because quite often we find that the GP is unaware of,
right.
of things that the Royal Free have done for my wife.
Martha, can you help us with that?
So again, it's incredibly variable. The GP won't know of all the appointments. They should have a letter when you've been seen afterwards.
Yes.
But they won't know proactively what the appointments are going to be. You should be able to. That's something that, in a way, you have responsibility for, rather than there's in a way no reason for the GP to know that you've got an appointment coming up next week for something, but they should hear after you've been seen by them.
I'll get the letter.
I've had experiences where I've had a copy of the consultant's letter sent directly to me,
but the GP says, we haven't got anything, can you please bring it in for us to photocopy?
Well,
This
that's
happens
an error.
invariably.
That's a real error, and that needs to be taken up with the Royal Free. I would to contact their PALS service about it. That's an admin problem. The GP needs to know, needs to have that letter. I'm quite, yes, I would be concerned about that.
Yeah.
And it's all done electronically now, so
Yeah.
the GP should get it really
I
easily.
kind of thought the GP gets it first and then
Exactly.
you.
No, that's my point.
It's happened so often, it's just
So I
abnormal.
would check that they have the correct GP on their records. They may be sending it to another GP. Excellent. Anyway, there are all sorts of things, but that needs to be tackled.
How do you get hold of an emergency supply or medicine?
Oh, so when you are very low, you go to the chemist and say, look, there's been an issue with the order, and they will offer, in some cases, I have had it, and they said, well, I'll give you a few pills just to last you for the week before, you know, if you have it. If not, I think they can get it. But yeah, I've had that, and they said, I don't know, something went wrong during COVID. The doctors weren't working full time, so they weren't approving some of the prescriptions. So I ran out and I went and then said, don't worry, we'll just give you. And it happened three times, I think. And they've just gave me like 7 pills and they said,
Particularly if it's something you take regularly,
Yeah.
then it shouldn't be an issue.
yeah. I mean, you know, hopefully that can be mitigated and you can keep an eye on, you know, with the reminders and everything, that shouldn't happen. But they, you know, I think in her case, she had one and she was really in a panic, which doesn't help with the blood pressure either. So I said, you know, go and speak to your pharmacy and see if they can give you an emergency supply. Viewing test results, again, a lot of people aren't aware of this, like this is available, because you don't actually get prompted. So if you say, for example, have a blood test, your results is going to be on your phone very, very quickly. And I had one a few weeks ago. By the time I got home, I had it in the morning. By the time I got home, about 4 o'clock, the results were there. I was very impressed. So it's a very useful thing to have. In a lot of cases, the doctor will phone you to discuss your results, but it's good to actually for you to have a look beforehand, just to, you know, see what's there and what you need to focus on when you speak with your doctor. Now, they have added visualization. So now they have a line, and we will sit and look at that on your phones as well. So when you look at tests, they try to make it very easy to read and understand for everyone. So what they've added is a line which is color-coded, so you have green, amber and red, and you'll see where you are. It tells you what the range is, the normal range is, the reference range, and then when you are with it. Okay, so we can look at that as well. It is very useful, and again, they're always trying to improve the visualization to make it easier to understand and see things. I will come back to all this organ donation and then linking accounts. They're a bit like I need to explain it, so I think I'll come back to it after the break. That's it.
Thank you.
Okay, so we spoke about test results, and I know during coffee time I spoke to a few people as well about the look and feel of the test results. And yes, for different tests it will look different. You may not get that line for everything, but you do for things like blood tests and so on. So yeah, it might look different for different conditions. You can also change your organ donation preference. So is everyone familiar with the fact that we are now opted in by default to donate organs? Okay. If you want to opt out, you can, but by default everyone is opted in. There is an option on the app to do that, to change your preference. And guess what? They've moved it somewhere else. So it used to be very obvious on the fast screen. You scroll down, you get to change organ donation. I looked the other day and I thought, it's gone. But actually it hasn't gone, it's moved. So it's now at the top right-hand corner. And again, that's something we can show you on your phone if you go into the app. So there's a little picture of a person, and that is your kind of personal details. It's got some of things like, you know, your preference for data protection, and one of them is changing your organ donation. And yesterday I had someone say to me, I have got the donor card, but I got it years and years ago. I bet it's not on the app. And I thought, let's test it out. We went on the app, and sure enough, it was there, it was ticked. So, you know, I think that's something that is important to bear in mind, and we'll go around and look at that together as well. Because it's useful to know that you can actually.
But can you say I'd like these organs?
No, so it's literally a tick, yes or no, but that
No, I mean, like,
on the app.
I like my heart to be donated. You can't.
Bigger mix.
Yes, so certainly not on the app, but I don't know
You
if
can
it's.
specify, because I've done it, but I didn't do it through the app.
No, the app just, yes, I think you can as well, but not, yeah, I think there may be other ways to do that. Marta?
I know there are some people, I mean, to be rather frank, we are all getting on with it. So our organs are perhaps not quite. Yes, they were. But there are certain things like on the ears and things that people might, so if people have a particular thing that they're keen on, then yes, I'm not sure what you selected, but you have to go with that. You have to go down that pathway. The other thing some people choose to do. I had a very good friend who had Parkinson's disease, and he chose to have his brain examined because after death, Parkinson's disease is something we still don't know as much as we'd like to.
So for research purposes.
For research,
yeah.
but those are all specific. They can't do that through the app. You have to sort of follow up.
Yeah. Okay. Thank you. And then the other thing you can do is what's called setting up a proxy account. And what that is you can link to someone else's account. So you can link, so if you're looking after a small child, or if you are looking after an elderly relative, if you are, I think you have to be in the same surgery, you can actually, the surgery will have to set that up and link you, and you can then act on their behalf. So you can order prescriptions for them, you can make an appointment for them. And actually, one thing someone raised yesterday was that she's really not comfortable using the app at all, and she asked if her daughter can, act on her behalf through the app. And I said yes, that's fine, and it needs to be set up with the surgery. I think they both need to belong to the same practice, if I'm correct.
To be
linked.
I'm not sure.
Yeah, it's something that the surgery can do. She's going to actually go to her surgery and request that. So I was saying to people, you can look after other people's accounts, but she was saying to me that I need someone to look after me, and that's absolutely fine. So you can, if you have an elderly relative, or if you want someone else to act on your behalf, you can do that, but you have to request that from the surgery.
I also don't know whether you need to have some sort of power of attorney.
I mean, my husband did it for, I think I know people who do it. It's up to the surgery. I think the surgery can, if they know, they know their patients.
If they know.
Yeah, I don't think you need it. You're not going to make some very serious decisions. You're really just going to make appointments for them, look at their test results. But obviously, it has to be approved. Quite the mechanism, actually, I don't know, but I'm not sure. I don't think it's power of attorney required. So, a lot of you have the app already, but this is just for people who don't. So, what you need is mobile data or Wi-Fi, a smartphone or a device, an email address, very important, and to remember which email address you've used to sign up to the app, because that's the one you're going to need to log in. Your NHS number is required for registering with the app, but if you don't have that, that's okay, because you can enter other information, and that's fine. Okay, so yeah, the NHS number, as I say, is useful to have, but it's not essential. Date of birth and postcode. It'll ask for a proof of ID or a code from the surgery. Proof of ID can be a driving license or a passport. Someone tried to use their Oyster 60 plus yesterday and it didn't work. So I think it needs to be something with your address and your picture. But yeah, it will actually guide you very, very nicely as you go and register. But that information again is also available on the NHS website in some detail. So it's all there. The other thing I'm going to show you in a minute. So yeah, to download the app is the usual app store. Search for the app. That's the icon. It might be a round circle, and then you install it and then you open it. The usual, like any other app. This is what it looks like. This is what you can do with it. As I said, you can actually book a vaccine. You can go on 111 online, and then health record prescriptions, test results, and so on. We've looked at that
Can
already.
I just flag up the messages thing? Because
Yes,
you should
yes.
be told that you get messages. I've just been talking to somebody who's had 5 messages she hadn't looked at, which doesn't really. If there's a little red thing in messages, then do read the message, because it may be about an appointment or something.
Yeah.
And you might get hospital messages and you might get GP messages.
Yeah, that's important. So a red sign means the message is not being read yet. So yes, thank you. That's important as well. Okay. Now what I'm going to do, if that's okay, Tony, I'm going to show some videos that are very quick about the app, so that you see how it works, and if you haven't already, if you're not using it already.
When you open the NHS app, you will see your name and NHS number at the top of the screen. Boxes under the heading Services and Your Health take you directly into popular areas of the app. You can use the Services area of the app to look after your health by ordering prescriptions or checking appointments. You can use the Your Health area to see and manage your healthcare, personal information and records. You can also use the icons at the bottom of the screen to see everything in these 2 main sections. Scroll down the screen to see your messages. You can switch profiles and see the NHS app account of a relative or person you care for. If you need help, visit nhs.uk/NHS app.
Okay. They are very short, so I'm going to look at the other one, which is repeat prescriptions.
You can order your repeat prescription on the NHS app. On the home page, select Request Repeat Prescriptions. You will see or can change your nominated pharmacy. Then select Continue. You will see your medicines, select what you need. Then select Continue. If you're happy with the details, select Request Prescriptions. Your prescription has now been requested. You can find out what to do next, see the status of your request, and see that the medicine you requested is waiting for approval. If you need help, you can visit nhs.uk/NHS app.
And the other one I wanted to show you is accessing your health record.
You can use the NHS app to see your GP health record. You can see information about your medicines, health conditions, and your test results. You will see a warning message saying your health record may contain sensitive information. Select Continue if you're happy to see your GP health record. You will then see information about your health conditions, medicines, test results, and documents. If you need help, visit nhs.uk/NHS app.
It's all dependent on it having been uploaded.
Yes, that's a good caveat, actually. Obviously, it needs to be, the data needs to be there to be viewed, and if it's not there, you can speak to your surgery and ask for it. But essentially, it's a tool that enables us to do quite a lot of things that would take a lot longer otherwise.
Excuse me, can I ask a
Any
question?
questions?
Yeah. Does it make any difference if you agree to cookies? I always disagree.
No,
I
so
don't
the
allow
cookies,
okay?
no, so the cookies are the, no, that's okay, that's absolutely fine. I don't think the app asks, does it?
Oh, just to ask
Oh,
for
no.
something before
No,
and it says
no, so
cookies.
no. The cookies are there to, because they're trying to get to know you better, so they kind of tailor the advertising and so on. On the computer and the browser, the cookies are useful because they allow you to go back and, you know, visit a website that you've already visited. You don't have to put the whole address so that it remembers you. If you can actually even clear your cookies from your browser, and all that data goes away. But you don't have to agree to cookies. No.
I only use my iPhone and my iPad.
Yeah. So sometimes it gives you an option reject cookies. If it doesn't, sometimes it says adjust settings of cookies, and then you can click on that and then reject them. But yeah, no one will force you to accept cookies, and that's absolutely fine.
When you asked about analytical cookies, is that less intrusive
Yeah,
than...
so on the website, actually, on the NHS website, it asks that, and I always accept it because, you know, I'm happy for them to know that I've visited, because what they do is just work out how many people are actually using the website, what they're using it for, which functions are more used than others, and I feel that's actually useful data for them, and it doesn't bother me for them to have it.
Yeah, it's different from advertising.
Yeah, yeah, it's just for them to keep tabs and so on.
I just went into my organ donation.
Yeah.
And you can change, I don't know if you can set it up.
Yeah.
You can change it. So
Correct.
if
Correct.
because when you said,
Yeah.
The lady was
No,
saying
no, that's
you
the point.
donated, I couldn't remember, so I
You can
see
tick
it,
yes or no, yeah.
and I can change it.
That's
But it
right.
doesn't give you a choice of organ, does
No.
it?
Yeah.
Does it?
But it tells,
Oh,
well, like it says you agreed to donate, and I can't remember doing those.
right.
And you didn't want to do those.
Oh,
And now if you want to change your mind. So
okay.
I haven't
Okay.
just
Okay, but that's interesting because you have done that separately. You've,
yeah, I think I got a form.
Right,
signed.
and that is very interesting because I haven't come across anyone who's done that, including myself. So us lot who haven't done this only have the option, a binary option of yes and no. But because you've done it before, they've moved that data across. That's interesting. Thank you for telling me.
Because I was thinking the other day, I've lost my card already.
Right, yeah,
Well,
yeah.
it's somewhere,
Yeah.
but I thought it was in my purse.
Yeah.
So if I was involved in an accident, presumably they just check into the
On the system, they
organ
have that.
system to see.
Yeah, that's right.
So I looked at managed health services for others. You can only add people at the same GP surgery.
That makes sense because they need to know you both. They need to have you both because they're proving it. They can't, and that's what I said to them yesterday. She said that her daughter was registered with a surgery before, so I said,
I don't think that counts.
yeah, exactly. So I think that may not be possible. Okay, so linking accounts, we've done organ donation. Thank you. Yeah, that's interesting where you can actually specify a bit more.
You can also opt into being involved in research studies.
Right. On that
I mean-
tab. Yeah.
Sorry, one other thing I've just seen on here. It says, I've gone into messages and it says you have 2 inboxes. Does that mean 2 messages in the inbox?
No, if it says
Two
inbox,
inboxes?
does it actually? Can we look at that afterwards? Do you
Yes,
mind? Yeah.
okay.
No, I'm going to set some time aside for that. It's absolutely fine. Okay. All right. So yeah, I'm not going to show any more videos, but essentially you can message your surgery, but it's not always available. I know one doctor came to one of the talks I did and she said they welcome messages, but only for certain things. They don't want people to kind of use that as a way to converse with the doctors because they have limited time. But for certain things, I think it's fine. And also for obviously the doctor to contact you. So we always think about ourselves messaging the doctor, but doctor if they need to contact you as well. What I'm going to do is, this is just something a quiz that we found that the NHS have put out. It's a fun quiz. We all did it in the office and we've got various scores. If it's something you want to do, you can do it in your own time. There is a QR code, but also there is a link to nhs.uk, and it's a health quiz. You answer some questions and then it gives you a score, but it also gives you some guidelines. It gives you some guidance on how you can improve your health. So it'll be things like smoking, drinking, and it'll give you advice accordingly. So when I did it, I was told to eat more brown rice and wholemeal pasta, but just everyone is different. So if that's something that you'd like to do, you can do it later. It's very quick to do and quite fun, really. So that's what it is. That's what it looks like. He got 6 out of 10, and he's smiling. So there you go. Okay, these are useful links in terms of NHS website we spoke about, and there's a link to the vaccinations. Barnet Council, it has information about libraries, about events, and that's quite useful as well to know what's going on in the area. There's quite a few health events going on, so we do a lot road shows and where different partners come along and talk about different topics. It could be diabetes, it could be smoking cessation, it could be different things. So I think it's good to know about those events and to come along. And then there is Age UK, which has a wealth of information about all of their events. and there are quite a few, and there are activities as well. And then about scam advice, or scam prevention advice rather. So, you know, they're very active in that area, and if you want some tips, they have a website. One word of warning as well is, and I have actually come across this, is in some cases you might get notification on your phone, text messages, about appointments that maybe you haven't made. Be careful, it might be scam, and I have seen it. Someone said to me, and actually looking at it, it didn't look right, so I could see that that was scam. It could be an email, it could be a text. So be mindful of that, and do check. If it's something that you haven't made, an appointment you haven't made, something doesn't make sense to you, it might be scam, and don't click on any links. So think before you click, is what we say. Really, really important, because it could wipe out your phone or put a virus in, and that's something you don't really want to happen. Okay, so what I'm going to do is, actually I wanted to find out if you have any questions, anything at all, but also to ask you if there's anything you want me to take back to the NHS and say to them, specifically about the app. I'm speaking today about that and presenting, so any feedback, please.
Yes, well, I was helping someone at club on Tuesday, and she couldn't get back into her account, and she had her password and she didn't remember her password. She only had one email address. She was certain about it.
Yeah, that's fine.
And it said, forgotten password. We clicked that.
Yeah.
It said, we'll send you an email with the password, and it never came. And
how long did she wait?
well, the session finished after we were checking every 2 minutes, and after about 15-20 minutes it still hadn't come in, and it was time to go home. So I said, and it said, and the message said, you will have an hour
to complete
it, and
so can I ask you something though?
Yeah.
How's the Wi-Fi?
The Wi-Fi is very good in the pub.
Is it?
Yeah,
So
it's not so good here.
That's not a reason.
Yeah.
So that's not a reason. First check spam, and I think you did. I know you know what to do that. So yeah, happy to feed that back. Happy to feed that back. It's important, because people get frustrated and sometimes they give up because they just feel, oh well, this isn't going anywhere, you know. So thank you. Yes, I'm happy to.
I am wondering now if perhaps she had not registered properly. You know, maybe she hadn't ever gone in.
It would have said that if it said.
Would it have? Okay.
It did. I mean, I don't know what the message. Whatever the message was, your.
The message was, check your email. We're going to send you a thing, and the email never came.
Yeah, and she entered the correct email address.
She said she only had the one email address.
And it was typed in correctly.
She said that's it. Yes. Yeah.
I mean, really, it's good to make a note of the email address and the password. If you don't want to write down your password, what I do is, it's a secret, but I'm going to share it, is I have certain passwords that I use, say 7 or 8 password, and I just put the initial letter and the number, so that anyone looking at it wouldn't know. They can try guessing, but it might take them a long time. So, you know, if you use 4 or 5, use the first 1 or 2 letters and the number, and write it down so that you don't. It is, so to avoid all of this, receiving an email and then waiting for it to arrive, try and make a note.
With this NHS app, I noticed that give you an option of using a pass key instead of a pass.
Yeah, you can also use a fingerprint and all of that. Yeah, you can do different things with it. Yeah, you don't have to have a password. I use a password, but I think there are other means of identifying yourself. It did ask me, I think, if I wanted to use, you know, either the face recognition or the fingerprint. Yeah.
But isn't that a good idea for people as they're getting older?
Yeah, if you mean to save you remembering password, it's an option you have, and of course you can do that. Yeah. A lot more people are using it now, I think, but it's entirely up to you. It's whatever works. Yeah, and I think you can change that as well. You can identify yourself by different ways. Yeah. Yeah.
If you're using the NHS app, will you still get notifications by text?
Because at the moment I'm
Yeah.
sent notification.
Yeah.
So it will be in both places.
It depends what it is for.
When
but
immunisations and things like that.
Yeah, you still get, yeah.
So it will come in both places.
Yeah, don't worry, you get them.
I
You
don't
get
know.
them every week. You will certainly get them.
You're well
Yes.
looked after every week.
Yeah,
that
you'll
they
still
need
get
to-
them. Yeah.
It depends on your practice, but again, my experience is that they do both.
Yeah.
Sometimes rather annoyingly.
Yeah, exactly.
Can you speak up when you, I can't hear a word you're saying.
Sorry, I said in practice I think they do both.
Yeah.
Yeah, you'll definitely see.
Yeah, it's a very basic question, but I've got the NHS app on my phone. If I was looking at my computer, well, obviously it's a bit easier to see things, how do I then get, presumably all the information's already in there.
Yeah.
But how do I go about, sorry, just getting it on there?
I mean, you can actually do a lot through the NHS website. When you come to things like order prescription, it will ask you to log in, and it's the same.
Oh, so if I go to the
Same
NHS
login.
website just generally, that comes up for anyone.
Yeah,
will
but
you
then you will ask you if you're trying to do anything
Yeah.
specific to yourself.
So
it will ask
it
you
will
to
give you an option to log in. It just assume that you might already. Thank you. Yeah.
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 So that's another way to do it.
Does the GP surgery use the NHS website to contact us?
The app, you mean?
Yeah, the NHS website. Do the GP use it to contact
The app,
patient?
not the website. Yeah, the NHS app.
Yeah, does the GP use it to contact the patient?
They might do. They might use it to
That's why
send.
it comes up in messaging.
Yeah.
I mean, like full vaccination, because they keep telling me NHS got a message for you.
Yeah.
I didn't know how to open it.
Okay.
I didn't open it. So eventually my GP sent me the text message as well. So I know that they try to contact me, telling me about the flu jab. So I just wonder,
Yes, so that's right.
I think they do
talk to
both.
each other.
Yeah.
I mean, I think that's I hope they carry on doing both, because I think text messages come through more quickly or more directly, and the NHS, you have to then go into it and check
Yeah.
your messages and things. But
So it's
I've
the
recently
same.
been in contact with a practice pharmacist, and he keeps sending me both.
But sometimes, actually, Martha, just to go a bit further, sometimes that text message is just a message to say go into the app to check your messages.
That's correct, yeah.
So you'll still have to go into your app.
Is it at the GP's discretion to use the app?
They
Or do
are.
they all use it exactly the same?
They are expected to use it.
I have no idea the answer to that, because I don't know them all, but as I think I've said quite often today, there's a lot of variability, so they will use it. So things like blood test results will come through automatically onto your app, which so the GP doesn't have any authority over that, they just do it, it just comes through. But things like uploading your past history and stuff is all the things that we've said depend on them.
Their system.
Have their system and having the manpower, person power to do it. So there's a variability as well.
But they're all expected.
They're all expected to use the NHS. Yeah, it's a national
Yeah.
thing. I mean, it's a slight. People quite used to ask me why I hadn't had results from the hospital. The GP won't have hospital blood test results or X-ray
No.
results. They can access some of the results, some scan results, some X-ray results through their computers, but they don't automatically get them,
Mm-hmm.
and they don't very often come through onto your NHS app.
So on the app, there is an option under test results.
Mm-hmm.
You can choose, is it a GP ordered test result or a hospital ordered test result? And we can look at that together as well. But there is that, and I'll show you on my phone. But I agree that some of it, I've had to have the same blood test twice because the hospital did it, and somehow the results didn't go through to the GP, so they ordered it again. But yeah, I understand that, but there is an option. So sometimes some of the data is available as well, if it's GP ordered or hospital ordered.
Yeah, there is. I was very struck. I went with a friend to a UCLH appointment recently, and he'd had some blood tests the day before at the GP, and those had come through to UCLH. So I think hospitals, they're trying to work on these interfaces, but hospitals have a bit more power than GPs probably with that.
Any other questions or feedback that I can? Sorry.
I'm just looking at my test results.
Yeah.
And it's on. Are those test results? I'm looking at them, so I'm just looking at
Sure.
one here.
Sure.
Thyroid
Yeah.
function testing. And then it says no it says healthcare professionals comment, and then it says no comment. So, is that my GP should have looked at that and put a comment on it? There's no comment on my MRI for my
Who? Oh,
breast.
sorry, the results were ordered by the GP, and
Yeah, I mean, they're regular tests that I have.
right.
Are they in the normal range?
Yes.
Does it come up in the... So if they're in the normal range, then you wouldn't necessarily
Yeah.
expect there to be a
So,
comment.
but I had an MRI,
Mhm.
I looked up the hospital.
The hospital result won't go through, the GP won't see that automatically, isn't it?
Well, they get a letter. That's how it
The letter will be.
My consultant
The
writes
letter
to
will
them.
be uploaded. Yeah, the letters are do come through. And
So each time they receive a letter, that should be presumably uploaded onto here.
if they upload it, yes. But
So
it's
we
not-
don't know if
Is that correct? It's not
It's
automatic.
incredibly variable.
Yeah, it's not
My
automatic.
letters don't go onto the NHS, I know from my practice, whereas a friend of mine does.
Yeah.
So,
Yeah.
I mean, I'm pedantic at home. I keep everything. Well, I've had cancer a couple of times, so I keep quite a good
Right.
record of it.
Yeah.
But it's just that it's confusing when you've got this
Yeah.
fantastic thing.
Yeah. Yeah.
But if it's not always 100% whatever, you're still having to keep
I
your own.
think you have to keep your. I remember, I had a couple of rather unpleasant illnesses, and I assumed that I was going to get looked after because I looked after people, but actually you have to manage your care.
I always say that.
And I think that's one message to take away.
Yeah.
Manage your care, be proactive, and ask for help.
Okay, but I'm going to make a note of that as
Yeah,
well.
it's just interesting. Well, it may be my GP doesn't put the letter on to. Like, I've had something recently, and I've just seen it on here, the letter that I was waiting for.
Yeah.
I haven't received yet.
Mm-hmm.
And it's something, just having a quick read on it, that really the doctor should have contacted me.
Right.
Because they're suggesting, and they haven't. So, but again, I guess it's like you
Again,
say, just keep checking.
being on top of it and then requesting an appointment if they didn't contact. Yes, I think
Write
sometimes.
to them and say, I'm querying why, this result that I've seen on my letter.
Actually, I don't know if this feedback is what you're really after because it's not about the mechanics of the
Yeah.
app. But I'm not sure I was saying that my record, lots of things that I thought was on there wasn't, it's missing. But what they have got on there, I find really strange, is that they've uploaded messages that they've sent to me saying that there's I should go for a flu jab or whatever. So they've uploaded the really dark
Banal
things
things.
and not and that doesn't seem to be
What is
missing.
missing?
Or just things like I said, some of my your GP history. I would have thought would have some things like if you've had cancer. And,
That's right. Yeah. Oh, so
nothing
your
like that,
history
and
is missing.
DEXA
Yeah.
scans that have been that
Yeah.
have shown
Yeah.
thin bones or whatever. Nothing like that is on there at all. And yet it's got that the entire letter inviting me for a flu jab.
So your history goes back how far? 1 year.
It goes back actually to 2 years because January, the actual history for, as far as that is, goes back to January last year. But then I've noticed as you were talking, I was going through it as it's got a couple of things like it tells me when I finished taking tamoxifen. That's the only sort of allusion it's got to that there's any problem in a certain year, but nothing at all.
Okay, so it's like a little bit incomplete.
Well, yeah, and incomplete as to the things that that I would have thought is part of your medical history that's more important than that flu jab.
Thank you, and I think
My
speak
guess
to your
is
surgery as well
the
and
admin-
see if they can dig up.
So
the
that
right-
should really be on
have
there,
every
yeah.
time we discuss something. Yeah, I mean, I've got lots of banal stuff.
Yeah.
Do you have access to your hospital records?
Oh,
Hospital letters, sorry.
No,
Through a
not, well,
hospital website?
only more recently I've been going to Moorfields and that is on there because it's very recent I think, so I've got some letters from them but nothing at all from
Before that.
Yeah.
My guess is that the admin department is very behind and they see your file is probably like
Yeah.
that as opposed to the other one. So they'll leave that one till later.
I mean, it should be on the computer. They shouldn't be looking at past
No,
paper.
it's true, but having the
Mine's got health conditions 0.
No, you're very healthy.
Well, no, I'm not. I mean, that's the joke of it. So, should I go to my GP and say, can you put my records
you
on?
can. You can,
Because there's
and you
nothing on
should.
it.
Yes, absolutely. You don't have to go. You can email them.
No, but what I mean is
Yeah.
it's their
Yeah.
responsibility.
It is their responsibility.
And they can do it.
only them can do that. It's not centralised. It is locally.
And then it says you currently don't have access to this section.
So that's what I was alluding to earlier as well. People have different levels of access, and I think that's done right at the beginning when you register the app, and you can ask them about that, and that's probably why. So they can change your access rights. Yeah, that is probably the reason actually, that for some reason people have different levels of access, and so some have restricted access and can't see certain bits of information. But, and that is something, yes, and please do speak to your surgery and ask them to change that. Absolutely, yeah. I don't know the reason why they've done it. They may be able to explain that, but that's for them to explain. Is there anything else? Everyone happy? Reasonably happy?
Okay. I had a question.
Yeah.
Historically, the hospitals have always sent my records,
Yeah.
mainly from the Royal Free, to a particular GP. But because it's a joint practice, I actually haven't seen that lady in about, I would say, maybe 7 years.
Mm-hmm.
What happens in the case where the letters keep going to her because that's what the Royal Free has recorded? And I've not seen her at all, and every time I go I see whoever's available.
Mm-hmm.
And many of them are locums or whatever.
In the surgery?
Yeah, in the same
Yes,
surgery.
okay.
It's one of these
Right.
group practices.
Yeah, sure.
So what happens, do they actually, the fact that the letters are going to this GP and she hasn't seen me in years.
Oh no, it'll be on the computer, that's fine.
So the system, certainly where I worked, and it's quite a common issue really, because the main GP is not necessarily the person you're going to be seeing, right you are. So we had an admin, actually a very helpful admin team, who would direct the letter to the person who'd seen the person most recently, the doctor who'd seen them most recently, for approval before it could be filed.
Okay.
So I would assume that every practice has that. Yes, it's got to be seen by a GP, and it makes sense for it to be the person who's most recently seen them. Obviously, if it's a locum and they're just on a one-off session, then it might help to them.
But can they not see that record on the computer?
Yes, but someone's got to alert you to see it.
And so when there's a complicated medical history, I just feel I'm falling between everything, because when you go there, they'll say, well, what's the most important problem today? And I'm saying, I don't have one most important problem kind of list out. And then they say, well, you could tell me about maximum 2. And it's just, I don't know how to say it because I've got so many issues. I don't know.
That's a perennial problem in general practice. I mean, from the time I qualified 40 years ago. And it's only got more complicated. But if you can try and see the same person, that's always helpful.
That's exactly it, but that's where it's hard. Because it's always who's next available. So I don't even go mostly to the GP at all.
Yeah.
I'm just going to hospitals.
I mean, also your app has a record of medical conditions that's available as well, to some degree of detail, obviously not.
Well, I've just checked my app. I've had quite a complicated history,
Yeah.
and it, without sharing too much, but it has things about sort of the surgery I've had or
Yeah.
chemotherapies, but it doesn't actually say what the diagnosis was, because somebody has just admin inputted.
Right.
So I really wouldn't be relying on the NHS app for all the medical history.
Okay.
I think you've got to manage that yourself.
Yeah. But we're checking to see what's there, and you know, if some of it might be helpful. Yeah. But it's not, remember, it may not be complete. That's the only thing.
And in your case, I would try and make a forward appointment a week or 2 ahead with somebody that you can see a bit more regularly, if that's possible.
Yeah.
It's always a good idea to stay with somebody who knows you already.
If possible. If possible, yes. Yeah. Thank you. And is there anything else, or we can actually go and look at individual phones and see if you have any questions about the app or anything else on digital online access to that? Is that, yeah? Should we do that? Okay, thank you.
Thank you very much.